Hi Anu.
Hi.
Now we are here at AstrooWorld Exhibition Center and you are at our stall which is buzzing with activity. So what are you doing here and what is this buzz about?
Well, we are telling people that we have various different services. I represent NES-Health as well as information technology called NES-Health.
Okay.
And they both very different concepts, almost like telling people that the earth is flat, not really, but the earth is round. So you can just imagine how much time it took for people to kind of change the concept. That's exactly what I'm trying to do.
Okay.
So health over here is the concept like the earth, which really isn't flat. It has many multi-dimensions, and that's the multi-dimension that we're looking at.
Right, we all know Earth is oval in shape, so that's what you're talking about.
That's right.
Yeah. So just for a common man, how is Mehta-Health different from health? So how does it make it different, and how does it make it different from going to a doctor, maybe, which is the most common thing we know about?
Absolutely. So you must have heard, in fact, if you go to Indian hospital, right on the top they've written stress is the cause of a problem.
Yeah, I've seen that.
Yeah? And that was the first thing that struck me, that doctors really do admit that stress is causing a problem. We just say the same thing. The only difference is that the way we're looking at the perception is kind of different.
Okay.
We're saying stress causes disease, but which stress? So my job is to identify the 30-second movie that caused a warp in your body and made your body adjust to whatever's going on outside. So basically what we found is that it's not major incidents that have happened in your life. The small things that happen in your life, which is like just 30-second movies, which get captured, and in that process you can create a deformation in the body, which you call a disease, which basically means you're not comfortable with something.
Cool.
Yeah.
So the diseases are as a result of some 30-second movie, and that needs to be solved the way you do, not because of just following the pills.
It's because the swallowing pills will be the precaution of it.
Okay.
So if you and I know when we have a pill, we generally will have a pill either, let's not joke about it, it's a contraceptive pill.
Yeah.
Or it will be
That's
a medication.
essential nowadays.
Essential, or it will be a medication to take off pain, aches, or swelling. So essentially we're just dealing with symptoms. But disease, if you say, you don't go and tell the doctor about this pain, ache, and he gives a label to it. And why get into those labels? When if you change the way you think, you can practically change, and you change your perceptions, not just thinking. It's not about positive thinking or negative thinking. It's how you perceive the situation to be. To give you an example, you remember when Manish, you were a small child? You talking on that day you were traveling in the train.
Yeah,
right? And then you were sitting in the train and you were looking outside and telling your mom, the platform is moving.
Yeah.
And you kept saying that.
Yeah.
And that's perception, right? For a 3-year-old, the platform is moving. That's exactly how we perceive our reality. It may be warped up, it may not be the real reality. And that warped up reality is what can cause that deformation in our world.
Okay.
Yeah.
So you're dealing with the soul.
Yes.
The 30-second movie is awesome. Wow.
Yes.
Sounds great. Okay, and just we heard you're going to December.
Right.
What is this about? How are you going to do that?
Well, I've been very fortunate, and I must say thanks to NES-Health people. They have called me, and all the work that we've done in India for the past 1 year, I'm carrying that work with little children. So we've had 3-day-old child who we worked on. We worked on children who got heart issues. So I'm going to combine Mehta-Health with NES work, with giving NES more prominence and making use of these little bottles. You see, these are information technology. This is water filled with information. This is like a pen drive for the body.
Wow.
Okay? And that's all we use for a 3-day-old baby, because I can't do any kind of psychoanalysis on her. And she got healed within 5 days.
Wow.
Yeah.
Those are amazing.
That's the power of, and when she had to be, I was told that she will be in the ICU forever, ever and ever. We never put her in ICU. She's perfect with us.
Wow.
And today she's 1.5-year-old. She also had her feet kind of turned. We worked with little gadgets around her, and she is working wonderful.
Wow, so something which perhaps would have required a surgery was done in a non-surgical procedure.
Absolutely.
Wow, sounds great. And apart from this, we hear you do some kind of workshops as well. What are these about and how do they help us?
We're doing workshops on Mehta-Health, and they're constantly conducted at Andheri. It's a 2-day introductory program. We also have a new technique that I've created which is called knock-knock who's there, which is around images. Mehta Health that we've already spoken. I also do the second level and the third level, which is we announce it. If you look at these brain layers, we're actually concentrating on what's happening inside the brain. And brain is actually a complete body. And so far the only difference is when the beautiful doctors, and they're very, very nice, I'm not contradicting them, but somewhere our education has been in conventional medicine. Anything that's below this is not psychological, anything above this is psychological. So my job is to bridge the gap between your head and the heart. Okay? So I've become the neck in between that's connecting the head issues with the ground issues. And that's exactly what I teach, how to do it, how to identify what the stress is, what are the triggers, and how to then sort it out. That's what I do.
Wow, it's an amazing world, and thanks for talking to us. And you make our world a healthier place to live in.
Thank you so much. You making it too by asking me.